Internal rotation treatment now. So pretty simple. We're going to have the hip in a certain amount of hip flexion. The idea for this treatment is to try and free up as much of, and we're looking at the TFL here because, as I said, 95% of the time that's where you're going to find this restriction for internal rotation. You're going to drop the knee over to adduction, which will basically help us lengthen the area that we're going to work. So that's really, really important because that's what we're trying to do. We're trying to free up as much as we can through that, obviously, the TFL. Now, depending on the areas that we're working, so if it was, once again, if it was an anterior hip, we would fall back into the same process that we did when we very first started the hip extension treatment. If it was the adductors, then we'd fall back into the hip abduction type treatment as well. So the idea is to sort of treat, reassess and treat. So it's a sort of a trial and error, if you like. So the TFL component here for us is really simple because, look, here's the TFL here, and obviously for Tess being a 400 metre runner, she's got a big, beautiful, strong TFL, but it could be highly loaded, and that will restrict that internal rotation for us. So we're going to start the treatment roughly down midway part of the thigh itself. Okay, so once again, we're going to use a little bit of cream. Really just a broad application first to start with. Now, we can use two different tools here, depends on yourself and depends on whether or not you've got a height adjustable table as well. So I'm going to use the, once again, the loose fist approach first, and then I can drop down and do a little bit of elbow work as well, or forearm work as well. Okay, so we're basically going to come in and we're going to pick up this fascia and also the muscle component of the TFL itself. And what we're looking at doing is challenging the tissue as we work through this hip adduction, okay, not abduction, all the way through here. Now keep in mind that we do actually have a trigger point in the very, very superior portion of that TFL. So sometimes we can sink into there and just work through that trigger point as well. But once again, this is a passive release technique, so we are working through that range of movement. So once again, if you do it purposeful and you do it right, you only need about 3 or 4 sweeps through that area. Then you'll need to come back, and then the idea is to reassess again. All right, now as you're reassessing, what you're looking for is if there is any more restriction anywhere around the hip itself. If they're having trouble telling you where they feel it, then that's what you're looking for. That is the plateauing out of releasing these restrictions around this hip. Okay, so simple being working down through the fascia and the muscle body of the TFL. If you want, you've got a height adjustable table, you can obviously bring it up, and then you can also do the same scenario, except you can use, once again, the fleshy part of your forearm. Okay, so please yourself which way you do that. More than happy for you to do either way or experiment with, but the whole idea is, whoop, put a trigger point there, and then sink in and work through the tissue itself.